Regenerative medicine is focused on procedural modalities, injections, shockwave, things like that, that actually trigger a healing response and are not designed to just cover up pain or injuries, but are designed to help heal the body and repair the body. So here at Cruz CORE, our regenerative medicine offerings include Prolotherapy, Platelet-Rich Plasma, stem cell, and shockwave. Prolotherapy is the oldest of the regenerative medicine techniques that we offer. It's been around for over 50 years, and it's using dextrose to act as an osmotic irritant and provide a low-level healing response for strains and minor injuries. The next regenerative medicine technique we offer is called platelet-rich plasma. And this is where we take a sample of a patient's blood, we centrifuge it down to obtain a very high concentration of their own platelets, which we then inject in areas where there is more of an injury pattern, typically tears or even small cartilage defects. Here at Cruz CORE Fitness, when we do platelet-rich plasma, we're typically using peptides to enhance the growth and regenerative effect, the biostimulation, if you will, of the injection. We also have a tool called VASPER, which is a very neat tool that combines cryotherapy, compression, and an electromagnetic field to enhance our platelet harvest from the patient's own blood. Stem cell is, if you will, the big gun of our regenerative medicine offerings. It offers the strongest inflammatory and thus healing response in a patient's body. We take stem cells, typically from a patient's pelvis, and then that high concentration of stem cells is injected in typically an area where there's a cartilage defect, and very frequently there's even microscopic bony deterioration or damage below that cartilage defect. Our stem cell procedure is a whole protocol, and it actually starts out with prolotherapy to, as I like to call it, prepare the tissue or prepare the soil. That is also incorporated with some hyperbaric oxygen chamber treatments in the week preceding the stem cell harvest in order to increase the yield of stem cells we obtain. And within a week, we do the stem cell harvest and injection on the same day. So about 6 weeks after the stem cell harvest and injection, we then perform a platelet-rich plasma injection in the same area, again, usually after a VASPER treatment, in order to prolong that inflammatory response and give those stem cells more of a chance to heal that tissue area. This is then followed by a couple of sessions of corrective exercise where we try and correct the injury pattern that caused the defect or injury in the first place. Shockwave is our newest offering here at Cruz CORE Fitness in the regenerative medicine world. We use a machine that some people even call lithotripsy. It is using a tip with a projectile that hits that tip and causes a pressure wave to go through the tissue. That pressure wave then causes a mechanical elastic strain on the tissue, whether it's edema, small pockets of fluid, or whether it's impingements in nerves or fascia. And that stretching pattern causes some mild inflammation and triggers a healing response. Shockwave is unique in that there's no needles involved, there's no downtime, it's very inexpensive, very fast, and it is diagnostic as well as therapeutic. So when I go over tissue where there's pain, discomfort, lack of function with the shockwave, I'm not only providing treatment and starting a healing response, I'm actually also diagnosing what is the injury, whether this is nerves, fascia, muscle, tendons, or cartilage. Please give us a call. We'd love to schedule either a telemedicine or an in-person consultation and answer all of your questions.